and you have to keep using stronger and stronger antibiotics. What this particular study, though, is suggesting is that not only do we need to worry about antibiotic resistance, but we also need to worry about immunity in our children. That if we prescribe too many antibiotics, they may not have the immune system they need to prevent things like allergies, asthma, and a lot of the other atopic diseases.
Let's hit on a specific example. I go to the pediatrician. My infant has an earache. We live that one. I know that one for a fact. And the pediatrician prescribes an antibiotic. What do you do? If not an antibiotic, then what do you do?
Okay, well, let's back up for a second. First of all, I think parents and pediatricians need to work together, okay? When your child has an ear infection, there are a couple of things to look at. Is there a fever with it? How many days has your child had the symptoms? If it's just been a couple of days and your child is fairly comfortable with just maybe some pain medicines, then they don't need the antibiotic. The antibiotics come into play when there are complications from a lot of these common childhood infections. Ear infections, after 7 to 10 days, they haven't gone away, there's pus in the membranes, yes, that needs an antibiotic. An upper respiratory infection a week later has turned into a pneumonia, absolutely that needs an antibiotic. But the key is trying to figure out if you have a documented bacterial infection that an antibiotic could help. While honestly in children, almost 90% of what we see is viral, not bacterial.
Okay, so to clarify, if bacterial infection develops, then it's okay to go with the antibiotic.
Then you absolutely need the antibiotic.
Okay.
You need the antibiotic.
And that's tough. I mean, like you said, what's the takeaway from parents here? I mean, it's not cut and dry. What do we need to do? What's the battle plan here?
Okay, it's absolutely not cut and dry, but that's why parents and pediatricians really need to work together on this. I think you have to look at how much discomfort is your child in? How long have they had symptoms? Can you wait a couple of days before this antibiotic really needs to be given? And then I think for parents, ask for a diagnosis. If it's really just a simple ear infection, an upper respiratory infection, or a viral infection, it doesn't need an antibiotic. If it's something more that's been dragging out for maybe longer than a week to 10 days, then yes, an antibiotic is needed. But the key is that parents and pediatricians are going to have to work together on this to really make the best decision.
All right, again, overprescribing antibiotics, something parents and pediatricians are talking about. Thanks for shedding some light and some insights on this one. We appreciate your time.